will be the alignment of the stars that makes something happen in terms of healthcare reform.
What we need to do is look at viable options for total health care for all Americans.
It's obvious to me and to others that I know, including some doctors, that it does not work. And by not working, I mean it doesn't serve all the people.
It's ludicrous to think that advanced nations we are would spend billions on war, but not on preserving life.
The American healthcare system, in my view, is so fragmented that it's very difficult to even begin to talk about what's wrong with it.
There may be disagreement about how, but no one disputes that our healthcare system needs repair. Too many people cannot access the treatment they need. Quality could improve, and costs are a worry for providers and patients alike. What we must do now, together as a national community, is decide, without hesitation or excuses for not acting, that healthcare for everyone is an urgent priority that can wait no longer.
Before the end of this decade,
our nation has heard ambitious calls to action before.
In putting a man on the moon as part of a great national effort of the United States of America.
Skepticism about this mission came quickly and loudly. There were so many reasons it couldn't happen, so many obstacles that would have made it easier to just walk away. Instead, we met the call to action with unprecedented passion and resolve. 8 years later, the once impossible became reality.
That's one small step for man, one giant leap for mankind.
Now we face a new call to action, one with even greater significance for our nation and everyone in it. This time our call is to change the U.S. healthcare system and make sure it serves everyone, not only those with the right job or the right pocketbook, and not only those fortunate enough to be perfectly healthy and have no pre-existing conditions. The American people are ready for change, and now the business community too is calling for reform, because the current situation is financially unsustainable. We can start by reauthorizing the state children's health insurance program early next year. More than 9 million children are uninsured, 2/3 of whom are eligible for this program, but not enrolled. The Catholic Health Ministry has been a strong and consistent voice of support for children's health coverage. Making certain our kids can obtain health care is not only the right thing to do, it is also a solid step in the direction of covering everyone. For the first time in more than a decade, we have an opportunity to make healthcare reform a shared national priority. The candidates for president talk a lot about healthcare because they know Americans are demanding something different. According to recent opinion research conducted for the Catholic Health Association, 85% of Americans believe healthcare is a matter of human dignity and should be made available to everyone because it is the ethical thing to do.
I do believe that there should be a universal health care system in the United States of America.
CHA's survey also revealed that almost half of U.S. voters think that the only way to get the change we need in healthcare is for citizens to demand it of their leaders.
We have to start making noise, and it's going to take revolutions, and it's going to happen in small groups at a time.
Our vision is of a healthcare system that truly promotes the nation's well-being and respects the dignity of every person. This ideal, drawn from Catholic social teaching and shared by many other faith traditions, begins with making sure that healthcare is available and accessible to everyone, with special concern for the vulnerable. Our vision also calls us to focus on prevention and make it a core part of the health benefits for every community. When it comes to financing, we envision a system that shares responsibility among all stakeholders. Similarly, we must all play a part in managing costs and ensuring that the system is patient-centered and designed to deliver safe, effective, quality care.
It is my conviction that we will only get healthcare reform worthy of the American people when the American people demand it. The United States today needs to use the experience and expertise of lots of groups to design a health access program for all, one that is worthy of our people and compatible with our cultural values.
No matter who is elected in November, Healthcare has to be one of the first priorities in 2009. The only way to make that happen is to insist, early and often, that change can be postponed no longer, that Americans are smart enough and caring enough to create a system we can all be proud of. The time to talk is now, and each of us has the power to make a difference. When the United States and its people decide something is important, we do something about it. For decades, the Catholic Health Ministry has been an unwavering voice for change. Now more than ever, we need to make every one of our voices heard. We need to speak up on behalf of our vision. We need to spark community conversations, get people talking, and voicing their hopes and expectations. With the window open and the American people expecting results, we need to emphasize dialogue over debate, consensus over conflict, and potential over politics. Join us in the cause of healthcare for everyone. Speak your mind, engage your friends and neighbors in the conversation, and help persuade our elected officials that we demand a different approach. We know it's possible, we know it's right, and we know it will take our collective energy and spirit to get there. With all of us working together, we can make this American dream come true. Because one voice can reform healthcare. Yours.